Hi, my name is Kathryn Budig, and I'm a model of courage for Ford's Warriors in Pink campaign. And today I'd like to teach you a yoga posture that's going to be useful for anyone who has gone through breast cancer treatment or surgery. So I want to preface this by saying that I would love for you to talk to your doctor first, because there is a time frame post-surgery where you should not be using your upper body at all. So please talk to the doctor, and then once you have the green light, this is going to be a good pose to start getting you back into a place where you feel strong and normal. So we're going to look at a very simple heart and chest opener. So take your left fingertips down to the ground, start to walk them away from your hip. You have the option to stay like this or start to bend the elbow and drop it towards the ground. Take your right arm up into the air, rotate the palm in, dropping the shoulder into the socket, and then a very slight side extension, reaching over to the left. So the goal is not to go as deep as you know how, it's just to create space. So this is going to start to stretch out the breast tissue, get into the pectoral muscle. This is also a great way to start to stimulate your lymphatic system. And if your neck is worrying you at all, look sideways, maybe even gaze down at the ground. And push into your left hand to draw you back up. Go over to the second side, right fingertips down, left arm up to the sky, rotate the palm in, relax the shoulder, and start to side stretch to the right. Maybe drop the right elbow down as you keep the opposite hip rooting into your mat. You can look up, you can look sideways, you can look down to the ground. Remember, the goal of this is to create space. This might be an emotional experience for you, so you might just want to hold for a breath. And if you feel yourself starting to get emotional, breathe deeper. Use your exhale to let everything out. And then press into the ground, come back up. So we go into neutral. So you can start to work this for anywhere from 1 breath to 8 breaths. And this is something that you can start to do every day. I know it's simple, but that's where we want to begin. Very simple, and just be honest and good to our bodies. So if you're still draining, you're in the middle of surgery right now, you're in the middle of a treatment, what I'd like you to focus on is more the lower body and opening up your hips. And I'd like to show you just an easy way to breathe. This is called pranayama, alternate nostril breathing. So take your right hand, ring finger goes over your left nostril, thumb over the right. And you're going to close the right nostril off, inhale through your left, close the left off, out through the right. And then stay on the right nostril, inhale. Close the right, out through the left. And then continue this cycle on your own, anywhere from 30 seconds to 5 minutes to 10 minutes, or basically as long as it feels good for you. So this is going to be a way to meditate, a way to invite power back into your body, and trust when it's time, this will all come together and this space will start to open up and feel like it's yours again. So if you'd like to learn more about the campaign, you can visit fordcares.com. And I thank you for your time and happy healing. Namaste.